everyone. My name is Dr. Singh, and I'm a board certified headache neurologist. I practice out of the John D. Dingle VA Medical Center in Detroit, and I'm the director of the Headache Center there. So today we'll talk about this question: am I having sinus headaches or migraines? And this is probably a really common question for a lot of people. I see it a lot, at least in my clinic. So we'll start with a case presentation. So this is a case, it's a real patient. So a 34-year-old man seeks treatment for a long-standing history of sinus headaches. He reports that his headaches occur with a frequency of 2 to 3 times per month. Each headache lasts about 48 hours. They're worse in the spring and the fall when his allergies are bad. His headaches begin with a feeling of pressure around his eyes with some nasal congestion. The pain intensifies and localizes into the periorbital area, which is the area around the eyes, and sometimes it throbs if he's active or bends forward. He also experiences some nausea when the pain is bad. He also reports some sensitivity to lights and sounds and has some clear nasal discharge. He's tried multiple sinus medications in the past and has been prescribed antibiotics on several occasions, which usually work within a day or two. He's missed work on 2 occasions in the past 3 months. And about a year ago, he also had a CT of his sinuses that showed some thickening of the mucosa in one of his sinuses. And his exam is normal. So we'll just keep this patient kind of in mind while we go through this presentation, and then we'll talk about this patient at the end. So just a little bit of background. The 3 most commonly diagnosed headache disorders are migraine, tension type headache, and sinus headache. And sinus headache is a really common term used among the public and primary care, but it's really rarely diagnosed by ENT doctors, which are otolaryngologists, and also neurologists don't use this diagnosis very often. So what is a sinus headache? So, headache diagnoses are based on international classification of headache disorders, and there's actual set criteria for each headache disorder. And headache attributed to acute rhinosinusitis is basically a headache attributed to an acute sinus infection, and these are the criteria to diagnose someone with that. So a physician would follow these criteria to diagnose someone with sinus headache. You have to have a headache, and you have to have some evidence of acute rhinosinusitis, which is acute sinusitis, basically. Either clinical evidence, so someone with a purulent drainage. You could use a nasal endoscopy, which is they put a camera up your nose and look, or if you have a CT or other imaging to show acute changes that are showing changes in your sinuses. And also, you have to have 2 of these following things also. One, that the headache developed with the symptoms of the sinusitis. And another of these criteria are if the headache gets worse with the sinusitis or gets better with the sinusitis. One of the other things that could accompany your headache could be that the headache is worsened if you apply pressure over the paranasal sinuses, so in your cheek area. And then if you have sinusitis only on one side, the headache also has to be on the same side. So you have to have 2 of these 4 things in order to meet criteria for this. And kind of similar criteria for if this is a chronic problem. So you have to have some evidence of chronic sinus issues. You also have to have a headache that developed with a chronic headache issues, as when the headache is better when the sinus issues are better, and the headache is worse when the sinus issues are worse. If you apply pressure over the sinuses, it should worsen the headache. And if the sinus issue is only on one side, then the headache should also be on that side. And so kind of moving forward, what's a migraine now? So, to contrast with the sinus headache, a migraine headache lasts anywhere, there's more specific criteria for this. The headache lasts anywhere from 4 to 72 hours. It has to have two of the following characteristics: one sided, pulsating, moderate to severe in intensity, and worsened with routine physical activity. You also have to have either nausea, vomiting, or light and sound sensitivity. You may have more of these associated symptoms, but you have to meet at least the minimum of two of the characteristics that I initially mentioned and one of the other ones that I mentioned the second time. And there have been actually multiple studies looking at sinus headaches because it's such a common diagnosis. And with multiple of these studies, it's actually shown that people that think that they have sinus headaches or people who have been diagnosed with sinus headaches actually have migraine. Here's an example of a study where they looked at 47 consecutive patients presenting to a headache clinic, responding to an ad saying, "Do you have sinus headaches?" They were enrolled in the study, and they were interviewed, and 98% of these patients fulfilled criteria for either migraine or migrainous headache. Another, study, there's been multiple of these, like I mentioned, but another study looked at about 100 patients and with self-diagnosed sinus headache, and then those patients were interviewed by headache doctors, and 63% of those patients met criteria for migraine, and another 23% of those patients met criteria for probable migraine. So, more than 80% of these people had probably had migraine. So the question is really if sinus headache is kind of a very niche diagnosis, and neurologists don't really use it. ENT doctors who specialize in sinuses don't really diagnose it. Why are so many people diagnosed with sinus headache? And also, why do so many people think that they have sinus headache? Well, there might be a couple reasons for this. One is that there's so much marketing of over the counter products using this term sinus headache. So when you go to CVS, when you go to any pharmacy, you see all these medicines being, given out for sinus headache. And usually it's just a generic picture of someone holding their head. And that might be a reason why people think that, hey, I have a headache, and my sinuses are in my face and my face hurts when I have a headache, so maybe it's sinus headaches. And when I take these medicines, sometimes I feel better. The location of the pain is another reason for people thinking that it's their sinuses. So their face may hurt, or behind their eyes, or their cheeks, that area might hurt, and that can be a reason why they think it's their sinuses or their forehead. Other reasons might be that they have associated runny nose or watering of their eyes with their headache, and that's why they think that they have sinus headaches. And another reason might be that it's triggered with weather changes, and they think that the weather changes are affecting their sinuses, and that's why these are sinus headaches. So one thing to keep in mind is that autonomic symptoms, is what we call them, are commonly associated with migraine, actually. So autonomic symptoms are conjunctival injection, which means red eyes, running of the eyes, eyelid swelling, nasal congestion, runny nose. These can all be associated with migraine. So that doesn't rule out migraine and rule in sinus headache. And why does it really matter that, I call this sinus headache or migraine? Why is it important to tell which is which? It's important because migraine is very, very common. About 28 million Americans suffer from migraine, and more than half of those people are undiagnosed. So migraine is debilitating and treatable. So if it's diagnosed properly, we can reduce a lot of suffering. And also, when people are diagnosed with sinus headache and they don't actually have sinus headache, this leads to delayed diagnosis, which we just discussed, but also leads to unnecessary CTs, which are do come with some radiation. Also, people are put on antibiotics when they don't need to be. It causes increased healthcare costs with people coming back to the doctor every time they have one of these headaches and thinking that they need antibiotics. And it also causes prolonged patient suffering. So let's revisit that case of that patient who has these, frequent headaches. So 2 to 3 a month, lasting 48 hours, worse in the spring and fall when his allergies are bad. Pain and pressure around his eyes with nasal congestion. Pain is worse when he uh, is active or bends forward. And he also has nausea, light sensitivity, sound sensitivity, some nasal discharge with this. Sometimes antibiotics work. Actually, I guess they usually work within a day or two. Um, and he has some CT findings of sinus disease. So this patient probably has migraine. They do fulfill criteria for migraine. Um, their headaches last 48 hours, so that fits migraine. The pain is throbbing. They're also worse with activity. The pain is moderate to severe, worse, does have light sensitivity, noise sensitivity associated with it. The fact that antibiotics help isn't really helpful with diagnosis because usually migraine headaches kind of go away on their own anyways within 72 hours. And the fact that he had sinus changes on CT isn't really helpful because if you go around and CT everyone, probably some patients will have sinus changes on their CTs but are asymptomatic. Um, so, kind of revisiting that question, do I have sinus headaches or do I have migraines? Well, if your headaches are moderate to severe associated with light sound sensitivity and you have nausea associated with your headaches, chances are that you probably have migraine. Migraine is very common, and you should seek treatment for migraine or use over the counter medications for migraine. Usually, 400 to 600 milligrams of ibuprofen can be helpful right at the onset of headache. If this is not something that occurs very commonly for you, that might be the first thing to try. Um, and sinus headaches are pretty rare, unless they tend to be more common with acute sinus issues. So if you are sick and have a runny nose and then have a headache associated with that, but gets better with your runny nose, then maybe you had a sinus headache associated with that specific illness. But usually, the chronic sinus headaches are very, very rare. Um, so that's kind of my presentation. If anyone has any comments or questions, feel free to email me